Thank you very much for inviting me to do the closing comments today. I have to apologise because I missed some of the early parts because I'm a paramedic consultant at the moment and it was slightly bedlam, so I got delayed. But what I've heard today has been absolutely fascinating, and it's really interesting to hear the different types of research. And I think, but for me, a big part about research, and it's about academic work, and it's about research and education, and why do you do it, and what's the end point. And I think for me the end point is always about the patient care in palliative care, and then it's the patient care who's important to the patient around them. And I think when we're thinking about what we're doing in education about research, that's where we need to be moving towards. So I know that the first speaker, and I didn't need to hear his speech this morning because he came and spoke to us at St. Francis Hospice about it last week, was Andrew Davis talking about hydration, or one of the things he's talking about hydration at the end of life. How do we know we're doing the right thing? And I think we don't know we're doing the right thing until we try and look at it in some sort of detail. There is a famous professor of general practice from Trinity called James McCormack. His great phrase was, "Learning by experience means making the same mistakes with ever-increasing confidence." And I think there has to be a bit of what are we knowing and how do we know we're doing the right thing? And some of that has got to do with that sort of critical thinking that we're at. How are we looking at this properly? How are we understanding it? And for me, one of the things I thought was very interesting was about, I think it's Charles Semple's presentation about education. How do you know education works? And the thing, I am involved at Beaumont Hospital, we have a study day every year, and without fail, when we look for feedback, everyone wanted more about symptom. Now, everyone wants symptom control, despite the fact there's always a symptom control presentation, but the feedback always is you want symptom control. You're thinking, where were you for the symptom control one? Everyone thinks the room was too hot, or everyone thinks the room was too cold. And everyone thinks the day was wonderful and marvellous. You know, there was all of those, but so yes, we've achieved something, but what have we achieved? So I like the idea of, if you're going to be looking at something, how do you look at it? And even that Kirkpatrick framework of how do you know the education is working? And then similarly, if you're doing research, how is this research making a difference? And I think this idea about implementation and how you're moving and implementing this further. And you might have noticed, I had two questions earlier on, and about, so this is about, well, if you're doing this about integration between oncology and palliative care, how do you know that that's the best way of doing integration? Because what else influences integration? And is that about the health system that you're in? And luckily I was able to get this clarity. This is very much a focus on the NHS. But then Siobhan Fox's work was about different types of dementia models. And I think it might have been Mark who sort of pulled out the other point that you might have different types of dementia models, but why are they working? And are they working because they're doing things that are important to dementia palliative care? And we don't always know what it is we're doing or why it's working. And I think that can sometimes then, and I think that understanding of what we do can be a challenge and a problem. And that might be sometimes why, although something seems like an inherently good idea, when it's done in one setting, it seems wonderful, but then if you try and move it somewhere else, it doesn't work. And some of the reason why it doesn't work is that it might be a wonderful system, but you haven't actually identified what it is about this system that's wonderful. You might think this is a great piece of research, but what is it that's made this great? Is it the actual intervention, or is it the person who's leading the intervention? And I think people might be aware of the Edinburgh Pain Assessment Tool for cancer pain. Worked incredibly well in Edinburgh. Got an enormous amount of money to try and expand that research. Had difficulty in even recruiting enough patients to it, but then it wasn't that clear how well this worked. But Mary Fallon was the person who led it in Edinburgh, and she was very much aware that I am committed to this, so it's going to work where I'm working. But is it actually that useful? So I think how the person drives it can make a difference. But if we want to try and develop these things, we want things to be implementable and sustainable, we need to have a better understanding of it. And some of that understanding of it, as Mark was talking about, is you're looking and seeing, well, what is it that makes this work? So having a really wonderful system to assess delirium, which is completely counterintuitive for the nursing staff and complicates the documentation, not much point in that. That's not going to work. So that idea of working with people, with clinicians, with researchers, with public and patient involvement is really important. So I think it's been a really interesting day. I'm sorry I didn't get to absolutely all of it, but I do think it's been a really interesting day. And I think it is an important thing for all of us that if we think about what research we're doing, why are we doing it? Are we doing the best type of research? And then how can we try and work and build it? I'm aware that some of the people present here are people who would have started in research. Like a lot of people present here are clinical people doing some research, maybe as part of a higher degree or a master's. But if you're doing that type of research, how do you help? If you're doing a taught master's, you don't have a lot of time to do a lot of research. But I think Sheila Payne made a good point. How do you know it's good research? And it's that idea of trying to do research and build the research so that you're actually adding, not so much adding to the sum of human knowledge, but adding to the type of quality of care that we're able to offer to patients and families. And I think those are the things, that I suppose is the end point of it. I don't think any clinicians here are in ivory tower, not clinicians. None of our clinicians are in ivory towers. I say I do work in Beaumont, it is not an ivory tower. But I don't think any of the academics here are in ivory towers very separate, because I think people have a good understanding of, the work alongside with clinicians, with patients, with families, to have a good understanding of what's going on. But those are the type, if we want to try and build and improve what we're doing, it's having the broadest engagement as possible when you're trying to design things, and then thinking of, well, if this is good research, well, first of all, is it good research? But then if these are good results, how do we make sure that we're getting this into practice, and whether it's about how we're educating staff, about how to have difficult conversations, or how we're actually providing care for patients or for families. So overall, it's been a very good day. One of the things that was on today as well, you had some poster abstracts and poster presentations. There was a competition for this. I'm happy to say I'm not a judge of the competition, but I'm very, very happy to say that I'm announcing the winner. And the winner of the competition, and it was a difficult decision from the judges. They said there's a very high standard, and it was quite difficult to make a differentiation because there were very slim margins between the different presentations. But the winner, and it does fit into some of these things about education, is about the impact of pain management education on palliative care nurses, a systematic review. And that has been presented to Shelby Baby, my colleague from St. Francis Blanchardstown. And just to say, I found out about 5 minutes ago there was a competition. I absolutely was not involved in judging the competition. Thank you. Thank you all very much. Any concluding remarks, or am I doing the concluding remarks? Will you say the few thanks? Thank you. No, I'm going to say some thank yous. And I think the thank yous I want to say are to particularly all the people in the All Ireland Institute who are involved in the organisation of this. We've heard from a number of the people here, some of you heard from who work within the Institute. We've also heard from people who are involved in the Palliative Care Research Network. We've heard from people involved in the organising committee of this particular conference. I'd also like to thank the members of Voices for Care, both for the work involved in the Palliative Care Research Network, but also for the work in general in trying to support engagement in relation to how we move and develop things further in palliative care in Ireland. I'd like to thank the people who presented. So people who presented the research, who are involved in the research in different parts of Ireland, and also people who have done research in other parts of the world. Thank you very much for coming along. And I'd like to thank our invited speakers, particularly Mark Pearson, who's really, because I think if we're not necessarily thinking through how do we get this from a research study, and the term that's sometimes used in saying things like drug trials, and that's from bench to bedside, or basically, so how do we get it from a lab or from a university out to the bedside? So it was really good to hear from Mark today. So also then I'd like to thank, lastly, yourselves for coming along. I think there's no point in having a conference or a study day if there's nobody to listen to it. So thank you all very much for coming along. I hope you've had a good and interesting day, and hope that this good and interesting day will inspire you both in your clinical work and in your education work and in your research. Thank you all very much.